Okay, so can you see my screen? So that I can show you the graphical representation of what I am talking about. So just like a recap. Few minutes, please. So this is the screen. Please, can you see my screen? Okay, so I showed them yesterday. If you can see my screen, which I believe you can, I showed them this yesterday. Can you look at it? Can you see this? Please kindly reply me in the chat box so that I will know that you are with me. This is saying you can't load the link. What happened? Okay, so my screen is visible. Thank you so much. So this is what I showed them yesterday. You can see the key. My screen is visible. Thank you so much. You can see the P here. You can see the QRS, which is ventricular depolarization time, and you can see the T, which is ventricular repolarization time. I also showed them that these 5 boxes measures 0.04. Each one measures 0.04, and the 5 is 0.20, 0.2 or 0.20, whichever. So these are things we basically did yesterday. And we actually, I showed them how to calculate pulse. How to calculate pulse from, I showed them how to calculate pulse from a graph. There are 3 methods. Please kindly rewatch, please. So there are 3 methods. The first method is R to R method. The second method is small boxes method divided by 1/5, or 1/5 divided by number of small boxes. And the third method is 300 divided by number of big boxes. Whichever one you use, you must be close to your answer. You must be close. Please note that you can zoom this on your devices. You can zoom this. If you zoom it on your device, it will give you a larger image. You understand? So you can zoom it on your devices. Okay. So let's go to today's work. Welcome, everyone. Welcome to today. So today we'll be starting with how to recognize normal sinus reading. How to recognize or parameters to put into place before thinking of interpreting ECG. There are some parameters you need to put into place before you think of interpreting ECG. The first parameter, like I told us yesterday, is the P wave. The first parameter is the P wave, P and PR together. P and PR wave together. You want to look at the P wave. Is it round? Is it covering 1 to 3 boxes? Is it preceding each QRS? This is it. Is it preceding QRS? Okay, you have to look at that. Secondly, you look at the PR. You know, I put the 2 of them together. Is the PR not longer than 5 boxes? I remember saying yesterday that if the PR is longer than 5 boxes, there is a problem. The patient may be tending towards heart block. Okay, so you have to look at it. Is the PR no longer than 5 boxes? Is it shorter than 3 boxes? Because it has to be 3 to 5 boxes. Okay. After this one, you look at the regularity. I explained yesterday that regularity is number of R to R. If you look at this one now, because the number of R to R, this tall one is R. So these three boxes in between is constant. So you can say this is a regular reading. If you have 4 big boxes here, you have 2 big boxes here, you have 3 here, you call that irregular reading. But when the boxes are constant, that is what we know as what? Regular reading. So in identifying the parameters to read ECG, you have to look at the regularity, P and PR, connection. Then the third one you look at is QRS. You look at QRS, like if you look at this now, can you see this? Can you see this as I zoom it out? You can also zoom it out on your devices. If you look at this QRS, you will see that it's occupying 1 box, just 1 box. And we say the number should be 1 to 2 boxes. So meaning that this QRS is good, QRX, meaning that is good. Then after examining the QRS, you will now count the pause. You will now determine the pause. We look at it yesterday. This strip is 6-second strip, meaning that the number of big boxes are 30. You see this mark, it comes after 5 boxes. This mark on top, where you are seeing this my cursor, this dots on top. If you are given a graph that has this, what you simply do is 1, 2, 3, 4, 5, 6. You know, you won't count the edge because it goes nowhere. And this will now make you to know, okay, 1, the whole inside, 2, 3, 4, 5, 6. So 6 multiplied by 5 will give you 30 large boxes. And that makes it 6-second strip. I remember saying that when you have 6-second strip, the best way to count your pause is just to count the number of R. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So this pause will be 100 beats per minute, because when you are done counting the number of R, you will now multiply it by 10. So we have looked at this graph now. See the P wave. See the P wave. You can zoom it at your hand as long as you can see my cursor. See the P wave here, occupying two boxes within the range. The PR, see where PR is. I showed us earlier. See where PR is. This is occupying 4 boxes, which is normal. But the image I'm using, the PR is just occupying 3 boxes, which is also not abnormal. Okay, this is the image I'm using. The image I'm using, the PR is also occupying PR. See, from beginning of P to the beginning of R, you should see 3 boxes. How many do you see at your hand? Do you see 3 boxes? Please, if you can hear me, kindly reply in the chat box. Do you see 3 boxes from the beginning of P to the beginning of R at your hand? Do you see that? Alpha, nobody is there. Okay, you saw 4. Okay. What do you see at your hand? Somebody have seen 4. At your hand, what do you see? What do you see at your hand? 1, 2, 3, 4. I think she's right. It's actually 4. Thank you. It's 4. So, and we say the number should be 3 to 5. So having this 4 means that our P is good, our PR is good. Okay, now QRS, you can see the R tall like that. And you can see that it's occupying only one small box. So this made me to know that the QRS is also good. Then we have counted the pulse. And we have seen that pulse is 100. What is the normal pulse for NCLEX? What is the normal pulse rate for NCLEX? What is the normal pulse rate for NCLEX? I'm waiting for our response. 60 to 100. Thank you. So this our patient is having 100, meaning the pulse is good. And the last thing is the regularity. We have looked at it, it is regular, meaning that this strip we are looking at is a normal sinus rhythm. Is anybody confused? So when you see ECG strip and you see normal sinus rhythm, consider these 5 things I tell you, and you will see that it's actually the reason, even on the physical paper, the P and PR, the QRS, the regularity, and the pulse, those 5 parameters. So that is what you should consider for every ECG. Anyone that does not meet up with the standard is definitely not a normal sinus rhythm. Do you understand? Can I move on? I'm waiting for us. So can I move on? Hello, nobody is responding. Can I move on? Oh, okay. Thank you, ma. Now, today we are going to, I've just discussed it, normal sinus rhythm. How would you know? The heart rate will be 60 to 100 beats per minute. The rhythm will be regular and R to R will be evenly spaced. The P wave will be present and regular and precede each QRS. The PR interval will be 0.12 to 0.20, originate from SA node, and that is the reason for sinus rhythm. And this is the example of the graph. I'm sure many of us have seen a graph like this in the past, haven't we? I'm sure many of us have seen it. So next time when you see your patient bring ECG to the ward or to the unit, you know what you do for me? Just snap it to me. Use this knowledge to tell me what it is. And if it's not right, or if there's something you need to learn better, I will let you know, okay? Would you do that? Now, let's go to sinus bradycardia. Let's go to sinus bradycardia. Sinus bradycardia, as its name implies, like I told us, it is a sinus because it's still being originated from the pacemaker, like SA node. So it's a sinus. But there's bradycardia. What does bradycardia mean? What does bradycardia mean? I believe we all know that, meaning that the pulse is low. So the implication of this is, even though it is being originated from the pacemaker, which is SA node, the pulse being generated is still low, meaning the pulse is less than 60. Now, for the elderly, for the athletes, you don't freak about it. In fact, as another additional knowledge, you could hear S3 sound. The normal heart sound should be S1, S2. But for this group of people, and they will be perfectly okay. It might be a normal finding. Now, sometimes the vagus nerve, that's the 10th activated. You see the patient developing sinus bradycardia. Like maybe somebody have inferior wall myocardial infarction, even vomit, straining from constipation. These are ways to activate vagus nerve. Sun shunning, all this will cause what? Reduced heart rate. When electrolytes are imbalanced, you can have that. If a patient is on beta blocker, is on some calcium channel blocker, it can actually happen. Then there are some other underlying pathological disturbance that can cause this, which is hypothyroidism. Okay. And there is a particular situation of the heart called sick sinus syndrome. It can also cause it, sinus bradycardia, meaning it originates from the SA node, and yet there is a problem with the pulse. So what do you expect pulse in sinus bradycardia to be? What do you expect pulse in sinus bradycardia to be? I'm expecting our responses. What do you expect the pulse of a patient in sinus bradycardia to be? Can you answer, please? What do you expect the pulse of a patient in sinus bradycardia to be? Are you responding? Can you hear me? Hello, less than 60. No, it doesn't have to be 30. Anything less than 60, even if it's 55. Even if it's 55. And like I said, it is perfectly, it does not denote a pathological disorder of the heart. There must be one or two things you look for. Okay, these are the symptoms, okay? Usually it might be asymptomatic, especially when you are talking about this group of people that I told you that they might have it and they will still be okay. The athletes, the elderly, and the athlete, the elderly, and the infants. The infant added to S3 tones, not to bradycardia. But the bradycardia, elderly, and the athletes, they might have it and they will be okay. So out of the 5 things I listed for us, the only thing that will be missing out of the 5 things is the pulse will not be enough. The pulse will not reach 60. That's the only thing that will be missing out of the 5 things I listed for us. The pulse will not be 60. Otherwise, every other thing will be normal. And the name sinus bradycardia will come up. See sinus bradycardia on our WhatsApp page. Can you see it? First, don't forget you have to be sure this is a 30-second strip, 6-second strip. 1, 2, 3, 4, 5, 6. Okay. Can somebody confirm with me that this is a 6-second strip? Can you confirm that this is a 6-second strip? Can you confirm that this is a 6-second strip? Below 60, thank you. So can you confirm that this graph I posted on the WhatsApp page is a 6-second strip? Is it a 6-second strip? Do you remember what makes a 6-second strip? I'm waiting for us. Oh. There's an image on our WhatsApp group. Is it a 6-second strip? Is it a 6-second ECG? Can you confirm that? Can you hear me? Hello? Am I still here? Oh, hello? No, I'm not asking you for the pulse. Please learn to do it sequentially so that you won't forget anything. I'm not asking you for the pulse of the patient. I'm asking whether this strip is a 6-second strip. Can you confirm that? Is this strip a 6-second strip? Please confirm that. Oh, are you understanding me? Is anybody confused? It's actually a practical class, and I can't do without asking you a question. Why it has not been so clear before is because you've always listened and listened without participating. You have to participate. Yes. What makes it a 6-second strip? What do you see there that make it a 6-second strip? What do you see in that strip that makes it a 6-second strip? What do you see in that strip that makes it a 6-second strip? 30 large boxes. Oh, okay. Thank you, ma. 30 large boxes. Yeah. So that makes it a 6-second strip. So how did I tell us that you should count? Because you were not in class yesterday and you didn't listen to replay, please go and watch the replay. We can't start that again now, please. So how did I tell us that you should count the pause when you have 6-second strip? How did I tell us that you should count the pause whenever you have a 6-second strip? How? How should you count your pause whenever you have a 6-second strip? How? Your pause, the pause is number of big boxes that you type here meant for the pause. No, it's not. So you mean the pause of this patient is what? If you have to count the number of big pauses, what's the pause of this patient? I'm waiting for our responses. R to R regularity. Okay, so count the pulse of this patient for me. I'm reading your chat now. Is there any chat on WhatsApp? Oh my God. I'm reading your chat now. I'm responding from there. I saw yes on WhatsApp and I'm here. I'm reading your chat. It's from your chat that I'm speaking out. So R to R regularity. So please count this pause for me. If it's R to R regularity, kindly count this pause for me. If you have 6-second strip, meaning that you have 30 large boxes, just use R to R, just count how many R is in that place and multiply by 10, and that is the pause. Now, somebody has come up with 50. So is this a normal pause? No. Okay, let's look at the P wave of the patient. I intentionally put it on WhatsApp so that you can extend it as long as you want. Okay, so this P wave, is it looking like a normal P wave? Normal P wave will be round, preceding each QRS, occupying 1 to 3 boxes. Is this P wave looking like a normal P wave? I'm sure that by now you actually know where the P wave is, so I don't need to start showing us again. Is this P wave looking like a normal P wave? Your response. Is this P wave looking like a normal P wave? Like the class is dull. You people are dulling my spirit to. You are not responding as per time. I don't know whether it's whether you don't understand what I'm saying. Okay, the P wave is looking like a normal P wave, occupying 2 boxes. I can see here. Then you look at the PR. Don't forget we have counted the pause. So look at the PR. Is it looking like a normal PR? You know why you should know this? Heart block, we also have bradycardia. Most of the time, what brings the patient with heart block to the hospital is because they have bradycardia. So you must be able to distinguish between normal sinus bradycardia and bradycardia of heart block. So don't see it like I'm stressing you, okay? So look at the PR. Is it the PR I explained to you? Is it the normal PR hovering 1 to 3, 3 to 5 boxes? Is that the normal PR? You are not responding. Oh, okay. Count out 30 boxes from the strip. Why are you counting out 30 boxes? This strip is 30 now. So we have a normal PR here. I have to go. We have a normal PR here. We have a normal QRS. And the R to R, even though it's shorter, the number of R we should have, even though it is shorter, it is regular. And that is the reason for the sinus. But the pulse that is low is the reason for the bradycardia. I hope we understand. I hope we understand. Now let's go to atrial flutter. Let's go to atrial flutter. Atrial flutter. I told us we'll be talking about happenings around the atrium today. There is this sinus tachycardia. Okay, sorry, I've jumped this. There is also sinus tachycardia. As there is sinus bradycardia, there is sinus tachycardia. Sinus tachycardia simply means that the patient, even though the pacemaker is the one initiating the impulse, the patient's pulse is very high. Even though the pacemaker is the one initiating the impulse, the patient pulse is very high. That's sinus tachycardia for you. Okay, how would you know this is sinus tachycardia? But in this situation, look at the age of the patient. Oh, maybe you are given a strip and you are asked what to do. You now look at that strip is now reading like 150, 140. Go back to that question to look at the age of that patient before you make a decision. Will 120 be wrong in a child of 1 year old? Will it be termed sinus tachycardia? Maybe they say that a patient 1 year old is brought to your unit, and this is with the following ECG reading. You now look at it, you now saw sinus tachycardia, 1 year old. So by the time you counted your R, The number of R, you now say that you have 12. Multiply by 10 is 120. You now have options like sinus tachycardia, bradycardia, normal sinus reading, supraventricular tachycardia. At that level, please go back and look at the age of the child. For 1 year old, that will be a normal sinus reading because their whole pulse is not 60 to 100. I hope you are getting the difference now. So always consider the age and the sex of the patient. I mean, the gender of the patient. In fact, in almost all the questions. As long as it's not theory question like theoretical base, maybe they are asking where is the position of the heart, and that's theoretical base. As long as it's not that type of question, please always ensure that you check the age, you check the gender. You get this exception. But if the person is above 12, above 10, 120 is already sinus tachycardia. Okay. How would you know this is sinus tachycardia? The P will be there. The PR will be normal. The QRS will be normal. R to R will be regular. But that reading will be choked. It will be so choked because the R to R are closer in order to accommodate more figures. You don't expect it to be spread out like the one that is 100. I'll give you a sample now. Look at how this one look like. You can see the space. By the time you're having sinus tachycardia, this space may be 2, 2. By the time you're having sinus tachycardia, this space you are seeing may be 2, 2 spaces, or even 1, or even 1.5, depending on how high the pulse is. And that is how you will know this is sinus tachycardia. Please, you need to be able to differentiate between all these, and they are not difficult. Okay, let me show us the sinus tachycardia in our WhatsApp group. Please check it there. Check it there. See tachycardia here. Have you seen? Okay, how many pulses do you have here? How many R do you have here? What's the pulse of this patient? That's the first thing, confirm is a 30-second strip. Don't forget to. First thing first, confirm it is a 30-second strip. Can you confirm that? Can you confirm that it's a 30-second strip? Don't forget to. That's where you must always start from. This is not even up to 30 seconds. How many large boxes are you seeing there? How many large boxes are we seeing there? It is. You mean that large boxes is up to 30 seconds? Could you count again, ma? Do you mean that large boxes, they are up to 30 seconds? They are 24. So this cannot be used. This cannot be used. This cannot be used. It's not up to 6 seconds strip. It can't be used. Do you see why you should count how many strip you have first? Okay, look at this. How many big boxes do you have here? How many big boxes do you have here? 3, 4, 5, 6, 7. This is 8 seconds. Now, how many big boxes do you have here? I've sent another one. Please check and let me hear your response. Why it's been looking like it's difficult is being made to practice. It's not this. No. I've deleted that one you're talking about. I've posted another one. So how many big boxes do you have here? How many boxes do you have here? I'm waiting for our responses. Where are you? How many big boxes do we have here? Does it take time to count boxes? Ah, I'm waiting for you. If you can still hear me, say hi. Maybe they can't hear me again. Oh yeah, now if you can still hear me, say hi. Hello. Hello. Like I'm not audible again. Okay, I see us better saying 40. That's good. These boxes are 40. Thank you, ma. Now, can you count the pulse of this patient for me? Thank you. Thank you, ma. Can you count the pulse of this patient for me? What's the pulse of this patient? What is the pulse of this patient? How many people are counting? How many people are counting? Oh, where are we? Count the pulse of this patient for me. The pulse is 120 when you select 30 boxes. Nurse Abigail. Okay. Okay. How many people can see this pulse to be 120 truly before we adopt it? Is this pulse 120? I'm waiting for more responses. What's the pulse of this patient? Pulse can, okay, 40 large boxes. Okay, thank you. So what is the pulse of this patient? What is the pulse of this patient? Don't worry, I'll wait for you. Why it's been looking difficult is because they don't really allow you to practice it. But don't worry, me, I will wait for you. Okay. So what is the pulse of this patient? I'm waiting. I need more responses. Okay, thank you, Nokabike. I've even read it on the YouTube. Who else is responding now so that we can move faster? Pulse cannot be 160. Oh. That means you are not removing 30 boxes. There is no way this pulse will be 160 because this is 8 second strip. Okay, can you use the big box method to solve this and see if you will get 160? Thank you. Not a big girl, you got 120. Can you use the big box method to solve this and tell me what the pulse will be? Nasola Jumoke, can you use the big box method to solve this and tell me what the pulse will be? This pulse is not 160, please. But you can use the big box method, meaning how many big boxes are from one hour to another hour. And once you are able to know how many big boxes, you divide by 300 in 6 seconds strip. In 6 seconds strip. Don't forget to, it still have to be 6 seconds strip. I saw it there, I read it, ma. I saw 160 and I mentioned it. So you should still get 120. So the pulse of this patient is 120. The pulse of this patient is 120. And that is a sign of what? Tachycardia. That is a sign of what? Tachycardia. But if you look at the P wave, is there, round, not covering more than 1 to 3 boxes, preceding each QRS. If you look at the PR will be like 3 boxes here. If you look at QRS, it will be occupying 1 box, and the R to R is regular. So this makes us to have sinus, but because the pulse is high, it becomes sinus tachycardia. I don't know what this 75 is for actually, but I hope we get this. This is how to recognize sinus tachycardia. Is there any question? If you have question, let's talk about it. I'm here. Yeah, it's 120. You see the reason why you must first count and be sure that your big boxes are 30. You must, it's a must. Please don't forget. It's a must, okay? Let's talk about atrial flutter. Let's talk about atria. That's P wave. Remember, atria is P wave. Flutter is like fluttering. So atrial flutter simply means that your P wave is fluttering. Atrial flutter, the big grammar that you have heard so far, means that your P wave is fluttering. The QRS will be okay because it's a regular rhythm. Because it's a regular rhythm, R to R will be okay, although some situation may cause irregularity, but the regular is more prevalent, okay? So because it's a regular rhythm, R to R will be normal. Now, how would you know that in this ECG, P wave is fluttering? You know, you remember I tell you that P wave is the atria. Do you remember? So when they say atrial flutter, it means P wave is fluttering. There is a typical appearance it will look like. How many of us have seen saw, carpenter saw before? How many of us have seen carpenter saw before? You know saw they used to cut, saw that they used to cut plank or wood. Have we seen saw before? Have we seen saw before? Hello, have we seen saw like carpenter saw? It's SAW. Have we seen it before? That is how the flutter will look like. the saw will look, the flutter will look like that saw. The flutter will look like that saw. Like that P wave, instead of it being up and round, instead of it being, see it saw, you will see it looking like a carpenter saw. There will be no distinguishing between, it's not possible to distinguish between the P wave and the U wave. Please check on the WhatsApp page and see what I'm talking about. Just check on the WhatsApp page and see what I'm talking about. To distinguish between P and T wave will not be easy because the P wave is fluttering. So that fluttering has changed the mobility of the wave to sawtooth. So in this situation, there is nothing wrong with ventricles. It's just that the two atrias are the one fluttering. Now, if you something like this, you can see it's like you're having 3T wave, 3P wave, or 1T wave, 2P wave. You can see them like there is continuous M, like there is continuous small letter M in between the two ventricles. When you see that one, looks like a continuous small letter M in between ventricles. So anytime you see this one, it is atrial flutter. No two ECG strip will look like this. Trust me, and by the time we'll be done, you will see that must be send the strip here. Oh, okay. So sorry about that. Oh, ma'am. I'm sorry. Oh, I'm sorry. I'm sorry about that. Sorry. Okay. So when you see continuous M, like continuous small letter M, in between the QRS, that is flutter. Nothing else looks like it. This is the best way to recognize it. And I'll give us, that sheet points for each of them. It looks like continuous small letter M, and you may have another one that will look like continuous small letter U. Either of the two of them, or whichever variance you are given, it is known as atrial flutter. Okay? Are we learning? Now, look at what it is. The patient will have palpitation. They might say, I'm feeling a kind of pounding or fluttering sensation in the chest. And you see P wave taking on a sawtooth appearance. So when you have this situation, depending on how the question is being worded, you might want to assess the patient first. When you have this situation, depending on how the question is being worded, you might need to assess the patient first. But if your question tells you that the patient had been assessed, go ahead and intervene. Okay? The intervention can be as little as administration of oxygen. The intervention can be as easy as administration of oxygen. So see what I was trying to talk about. That's AFib. Okay, this is flutter. You can see flutter here. it's supposed to be regular, but occasionally can be irregular. Atrial rate. Atrial rate is counting all these things that look like P wave. Let's look at it. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21. So all these things that looks like continuous M or continuous small letter U in between the QRS are what we call atrial rate. And for this strip is 210. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. So this is a 30-second strips. This is a 30-second strip, okay? So we can use the whole graph. In 30-second strip, go ahead and use the in 6-second strip, sorry. Go ahead and use the whole graph. It is only if it's more than 60 seconds, you will now remove 30 out of it. Okay. P wave are consistent. There are 2 for every QRS. You can see, and it can be 3. It can be 2 to 1. It can be 3 to 1. Okay. And you can see, like I said, treatment depends. Okay. Treatment depends. Depending, it might be necessary, or the patient might not feel. It might be asymptomatic, and it might be symptomatic. If it's symptomatic, the patient may need to be given synchronized cardioversion using 50 to 100 joule of energy. If it's causing increase in ventricular rate. For this patient now, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. This ventricular rate has been affected because this is 110, but this might not even produce a grave symptom. Okay. They might just be giving beta blocker or calcium channel blocker, and it will help them, to correct this. So let's go to AFib. And after AFib, we go to SVT. I will make sure we get it done. Now, AFib is irregular. Like, you can't see my screen again. Okay, thank you. AFib is what? Is irregular. This is one way to distinguish between A flutter and AFib. A flutter is most times regular, meaning that R to R will be constant, while AFib is always irregular. So even if what P is doing, like atria now P, even if what P is doing in between is looking the same, they might give you a graph where the P will look the same. Just look at their regularity. See the AFib. You can see that this P is also looking like sawtooth. You might have the one that is actually fibrillating, like that our water wave here. You might have one that is actually fibrillating, like that our water wave here. But you can have something like this too, bringing a confusion between what we know as bringing confusion between what we know as AFib and A flutter. Do you understand? But when you have such a confusion, maybe you are finding it difficult to distinguish between sawtooth and the other presentation, just look at this R to R. Sorry, I have tonsillitis. That's what I've been trying to cover like that. Sorry. So when it's like it's not it's confusing. AFib, A flutter, just look at R to R space. In this diagram now, this R to R, some are 4, 1, 2, 3, 3.5. Some are 2, some are 2.5. You know, just staggered like that. Know that the only situation or the only condition that will present with this type of P wave and irregular R to R is AFib, atrial fibrillation. Do you understand? Do we understand? Let me know if you understand A flutter, AFib, and how to distinguish it. Do you understand? They are not responding. No. So this is AFib. And know that what happened, the P is fibrillating. The P is fibrillating. And just like the A flutter, the treatment, it depends on whether the patient is stable or unstable, meaning that you still have to assess this patient. If the patient is stable, what would you say? The pulse, mental alertness. The patient will have a good pulse, she will have mental alertness, and she will not complain of any condition. So we say that patient is stable. If the patient is not stable, you might say, yeah, I feel like my chest is coming out. My chest is pounding. Another thing you should know about AFib is that even not this condition, AFib, A flutter, there's a tendency for blood to clot, because what caused the fib and the flutter is instead of the atria to hold on for the heart to be filled up before contracting, it's just quivering like that. You know, it's not doing one contraction and stop. It's like it's in a continuous contraction. So there's tendency for blood to pool. And don't forget that ventricle is not in continuous contraction. It's just the atria. So while atria is doing that, the blood might be pulling down in the ventricle, which can cause clots. And this patient will now have risk for a stroke. So part of the drug you are going to anticipate for this patient is anticoagulants. When a patient is on anticoagulant, depending on the one they are giving, if it's heparin, you check APTT. If it's warfarin, you check PTINR. Most times, warfarin will be used. And when you use warfarin, you check PTINR. Why the normal INR is less than 1? For a patient with this situation and they are on warfarin, their INR can get up to 3 and still be fine. Don't run around for it. Your question says, who should you see first? You now see a patient with AFib, A flutter, on warfarin with money lab of INR money lab of 3. Please, there's no reason to run around for the patient. He's not at risk of bleeding at all. He's okay because it is expected for the drug he is taking. Do we understand to this level? Please, we have to stop it. I will continue tomorrow. We'll continue from supraventricular tachycardia tomorrow. Please, we have to stop here. We are sorry. Did we add anything to you? Has anything been added? Have you learned anything new? I hope your 1 hour, 12 minutes has not been a waste. Have you learned anything new? Where are our responses? Nobody is responding to me. Yeah. Okay. One person have learned something new. Not better. Thank you, ma. Have we learned something new? Absolutely. Though you joined late. Please listen to the audio later, the video later. And don't forget to listen to yesterday's one too, because it's a continuation so that you have a good understanding of what we are talking about, okay? So thank you so much. See you by 6 p.m. tomorrow. God bless you. I love you. I gave assignments yesterday. Only 2 people did it. Out of the 2 people, 1 person got it right. The other person didn't get it right. I told her to recheck. She never get back to me. One of the main things that brought us here is practicing it. Practicing it. At the beginning, it might look like we don't know it, but you gain mastery of that which you practice over and over again. Please don't forget. I may just post some of the strip on that our WhatsApp page and ask us, what is this? What is this? Just to ensure that we practice on what we have learned so that we won't forget. Okay? Will that be a good idea? Not when I post and I won't see anybody. It's not a good idea. What's the meaning of normal, please? Not wow. Will that be a good idea? So I will do that. If not tonight, I will do it tomorrow morning before the next class. Please make sure you respond, okay? And if you have not subscribed to this our channel, you are owing me a bad